We have Mr. Terry Perrier, who does water quality control, not only for this community, but also for the communities of Winneway and Temiskaming. He regularly tests our drinking water to ensure that we do not run into any of the problems or situations that occurred, like in Walkerton. The lab is fully equipped. It's within this health administrative facility, and we know in 24 hours the quality of our water. And actually, we would like to potentially expand the delivery of this service, seeing as we have the facilities to do the water monitoring and quality control.
Good, that's excellent. Well, it's very impressive. I have to tell everybody out there when you do have your official opening, which when are you planning on having this?
Around the middle of April, we have to take a little bit of time. We have to invite all of the appropriate dignitaries and funding agencies that have contributed to the development of this building, in particular representatives from Health Canada, the Department of Indian Affairs, the CRIC, the various contractors, subcontractors, members of our tribal council, the technical unit at the tribal council, which assisted us in the building and designing of this complex. So there are many people to invite, and it's to ensure that there is adequate time frame to allow these people to receive our invitation, accept it, and come and have a look at the beautiful building that they've so generously contributed to creating.
Is this going to be open to the public as well?
Yes, the intent is to have a grand opening, an open house the week prior, or during the week of the grand opening, to allow our members who haven't had the opportunity to come and see this facility, to come and have a look, meet some of the people who will be delivering the programs and services to them, but also to the non-native population who would like to come and see what we are trying to do and what we've been able to accomplish as the First Nation community that resides in Kipawa. It's quite interesting.
It's very impressive.
Very much so, and I think it would be good for the people, to come and see what we're trying to do here. And there seems to be a lot of misunderstanding and misconception as to, what our actual intent is, but we're like a municipal government, except we're a First Nation government, and we render the same type of programs and services to our population as the non-natives do. And we are quite proud of this building and are very open to individuals to come and have a look at our facility.
Good stuff, good stuff. I think now we're going to move into the, what is it where the nurses are, where they treat the patients firsthand?
It's an examination room, clinic room. We have a full-time nurse who is always working here, and basically what she does is frontline work.
Okay, we'll go check it out. Let's go check it out. Okay, we are now in the examination room that the public comes into when they have something wrong with them and they want to get assessed. Give us a little bit of an explanation on how this process works.
Generally, prior to this, having this facility, if a person woke up in the morning and was not feeling well, or was under the weather for any reason, or had a pre-existing medical condition, they were obligated to go all the way to Temiskaming to be seen either by a nurse and then a physician. What we're able to do here by having this type of facility is offer a portion of the service that is rendered by the CLSC. Our community members come here first if they think they have a medical problem. They're assessed by the nurse, and if she can treat them, she does so. Also, she can provide them over-the-counter medication, such as Tylenol, Band-Aids, and if it's more serious, she refers them to the CLSC and the physicians that are available there. It's quite an interesting process. It saves our members sometimes some unnecessary travel, and it also ensures, that the services are rendered within the community, which is the overall intention. It's also to bring in visiting physicians at a later date. There are many things we would like to do with this particular aspect, in particular with health, and it's to bring the physicians into the community instead of having our community members continually traveling by taxi to attend their various medical appointments. So we're looking at expanding the type of services that we can deliver within the health sector component.
Well, just by walking around down here, the potential is great. I mean, you've got quite a facility here, so I'm sure a lot of physicians would be happy to come and work in a facility like this.
I hope they are. We will be making the invitation to, in particular, the CLSC and the physicians that are already treating our members. That would be an interesting approach and concept, and it's something that, if we're reelected as in the upcoming election, that we would like to focus on and enhance and improve the quality of programs and services that currently are being rendered to our population.
Good stuff. And just a little bit about this room. I'm sure people by just looking can see it's very warm. It's very inviting. You don't feel that cold, harsh, like, oh, I don't think I want to go in.
Hospital, exactly.
Yeah.
And that was the whole idea behind, having this type of service available, is to make our members feel comfortable, even when they're probably, not in the right mood, I guess, to feel comfortable. Most people, including myself, when you have to go to the hospital, it's somewhat intimidating. But the idea was to soften the, or the impact of having to, be sick and suffer and deal with the consequences of that happening.
Well, it's right next door, basically, so that's great. Well, this is definitely an impressive part of the building. Now, is there anything else you want to add before we wrap things up here, Lance? Is there anything up and coming other than the election that you can think about that you'd want to tell the community members about, or any other facilities here that we've missed? I think we pretty well covered it all.
Yeah, the only facility that you haven't seen is the lab.
Yes,
And
yeah.
the water testing equipment that is available here.
Okay.
Well,
Let's go take a look at that.
Sure.
Okay. So here we're in the lab where the water testing is done. Maybe you can just talk about a little bit about the water testing, how important obviously it is, and how extensive it is here.
Okay, well, as I mentioned to you previously, we do all of our own quality control for our drinking water supply. It is done by one individual, Mr. Terry Perrier. He does it on behalf of all of the three communities that I previously mentioned, Winnoway, Temiskaming, and Eagle Village. This water sampling is done on a weekly basis, and the results are available within 24 hours. If there is a contamination problem, the community that the water sampling was taken from is notified. Subsequently, a boil order is ordered, and a retest is ordered immediately. And he does this on a weekly basis for the three communities. And it ensures, I guess, to our population that the quality of their drinking water supply is maintained at a very good level. And the type of sampling and monitoring that Mr. Perrier does now will be even increased in the upcoming fiscal year, which begins April the 1st, as a result of the situation in Walkerton last year.
Yeah.
They are putting in additional collection and monitoring programs to ensure that any of our member communities do not get into a situation similar to Walkerton.
And did you say his name is Mr. Terry Perrier?
Yeah, Terry Perrier.
Okay, that's really funny. I'm thinking Perrier water.
Actually, it is spelled the same way.
That's what I'm thinking of. I'm sorry. I just thought, well, that's really kind of ironic that his last name is Perrier.
Exactly. But, he's done this job for us for about 4 or 5 years. And actually, I guess his intent is to become an EHO. And as I mentioned, with the new guidelines and regime that is being put forward by Health Canada, there is an opportunity for him to be trained and educated to become an environmental health officer for all of the Algonquin communities within this region.
Well, that's great, Lance. This is very impressive. I see you've got all the equipment in here that's needed for that, and it's great.
It has to be finalized setting up. As I said, we've only been here since the end of January, but we will be a full and up and running operation by middle of April. Should be fully staffed and being in a position to offer all of the programs and services that our band members should have had access to previously.
Well, congratulations. It's a great building. It's very impressive, and I think your community has a lot to be proud of.
Thank you very much.
Ben, bonjour tout le monde ou bonsoir, bienvenue à Rien de plus simple. Présentement, je suis devant la clinique dentaire où je vais aller faire une entrevue. Et là, je suis très anxieuse. J'espère que je me ferai pas trop chaud dans la bouche là, parce que j'aime pas ça. Mais je vais poser des questions, puis j'espère qu'il va me réconforter parce que j'ai des questions par rapport au traitement de canal, tout ça, là. Des choses qui font peur aux gens. Alors, restez là et tout de suite après, il va y avoir l'entrevue avec le Club Richelieu qui vont faire bientôt leur 26e revue Richelieu. Merci. Bonjour à la maison, je suis en compagnie du dentiste André Réveliquette car c'est le mois de la santé dentaire. Bonjour,
Bonjour,
ça va bien?
ça va très bien.
Là, on va parler d'un sujet que ça terrorise un petit peu les gens. On va parler de l'hygiène dentaire.
Parfait.
J'ai quelques petites questions. On est dans tes bureaux en ce moment. Et par rapport à tout ça, j'aimerais ça qu'on parle des jeunes enfants. On va commencer par ce sujet-là. À quel âge on doit amener nos enfants chez le dentiste?
Moi, je conseille aux parents de les amener à peu près à l'âge de 2 ans. 2 ans, 2 ans et demi, parce que, disons qu'à 2 ans et demi, c'est l'âge moyen que les enfants vont avoir leur dernière dent, leur dernière molaire. Donc, à 2 ans et demi, c'est un bon âge pour les amener. Il y a des familles qui viennent, qui viennent avec un de leurs enfants, l'autre vient. Des fois, s'il y a 1 an et demi, 2 ans, si l'enfant veut, on va le prendre, mais on ne forcera pas les enfants. Même à 2 ans et demi, là, on ne forcera pas les enfants non plus, là. On va les laisser aller à leur rythme, là. Surtout s'ils n'ont pas de problème, là. S'il y a des problèmes, là, c'est une autre question, là, mais quand ils n'ont pas de problème, on essaye de ne pas les pousser non plus. Mais 2 ans et demi, 3 ans, c'est la bonne âge pour les amener.
On parlait de biberons tout à l'heure. Faire sûr aux parents de ne pas laisser les biberons avec du jus la nuit aux enfants parce que ça cause des caries. Il y a plein de petits trucs hein, comme ça.
Oui, c'est ça. Le gros problème, là, c'est des caries chez les jeunes enfants, c'est le biberon. La carie du biberon qu'on appelle. Puis, c'est pas juste le jus non plus. Il y a des parents qui pensent que c'est parce qu'ils donnent pas de jus dans le biberon de leur enfant, il n'y a pas de problème. Non. Le lait peut causer autant de problèmes que les jus. Parce que dans le lait, tu as le lactose, puis le lactose, comme le fructose, le glucose, c'est un sucre qui va attaquer l'émail des dents. Donc, c'est à déconseiller que les enfants dorment toute la nuit avec leur bouteille de lait. Il y a toujours moyen de leur en donner une au coucher, quand ils sont endormis, de leur enlever, ou tout simplement, moi, ce que je dis aux parents, c'est, bon, arrivez pas demain, puis leur enlever la bouteille là, de tout de go. C'est d'arriver, puis peut-être diminuer. Moi, je leur conseille de faire... je sais pas moi, 3 quarts de lait, 1 quart d'eau. Tu fais ça une couple de jours, ensuite de ça, tu diminues une demi, moitié, 1 tiers, 2 tiers, jusqu'à ce qu'à un moment donné, tu te ramasses avec juste un biberon d'eau. Comme ça, il y a toujours son biberon, puis il y a pas de problème de ce niveau-là.
On économise des crises.
Oui, non, c'est certain que c'est mieux de ne pas les brusquer, là, parce que c'est comme chez le dentiste, c'est la même affaire. C'est pour ça qu'on les pousse pas, parce que si tu les pousses, puis ensuite tu les forces trop, c'est certain, comme je te dis, en autant qu'il n'y ait pas de problème, si tu les forces trop, ben là, à un moment donné, après ça, ils sont réticents, puis ensuite, tu as des problèmes à les faire rentrer, après ça, tu as même des problèmes de les embarquer dans l'auto quand il est temps d'y aller. C'est d'y aller tranquillement.
On a parlé de plombage un petit peu aussi tantôt avant l'émission. Tu m'as expliqué par rapport aux amalgames, au plombage. Peux-tu être un petit peu plus précis?
OK. Les plombages,
Oui.
disons ils ont commencé à appeler ça comme ça parce qu'au début, il y avait du plomb. Là, on parle des plombages en argent,
OK.
qui sont de couleur argent. On appelle ça de l'amalgame d'argent. Donc, il y a de l'argent, il y a de l'étain, il y a différents métaux, mais il n'y a plus de plomb. Puis une des grosses composantes, c'est le mercure. Puis c'est ça. Là, il y a eu une controverse là, au niveau du mercure. Ça a commencé pas à s'adoucir, là, mais disons que c'est moins pire que c'était. Là. C'est moins... on s'est aperçu, là, il y a quand même pas plusieurs études scientifiques qui prouvent qui donnent le mauvais côté du mercure. Il y en a autant. Il y a autant d'études sur un côté que sur l'autre. Sauf que c'est un matériau que les dentistes utilisent encore, puis que je suis certain que les dentistes vont continuer à utiliser. C'est un matériau qu'on utilise, ça a au-dessus de 100 ans, puis c'est le rapport qualité-prix d'un amalgame par rapport aux autres restaurations, il est vraiment, vraiment supérieur. Là. Mais il reste qu'ils sont à travailler sur un nouvel alliage qui enlèverait le mercure complètement, puis avec une autre sorte de métal liquide qui, lui, n'est pas toxique. Donc, ils sont à travailler là-dessus, mais ça, c'est des travaux de longue haleine. Puis, de l'autre côté, les plombages blancs, c'est certain que depuis, je dirais, 15-20 ans, ça